I've read them. So I will make the motion to approve them.
I second.
All in favor?
Aye. Are we muted?
I'm not.
Toyota said aye. He was muted though. Yep.
Okay.
Marlene says aye.
All righty. So I guess those pass. So with that, guess we'll go on. Did we have any old business listed, Evan?
No, I think we had kind of closed up the supplies issue, Susan, unless that's reared up again. I think we're in good shape there. So that was really the only ongoing issue we were discussing, other than the nurse practitioner, allowing them to non-physician practitioners to order home health, which that's in progress on DMS's side to get those rules in place, as well as the telehealth. So those were really the only items that were kind of discussed and somewhat outstanding from last time.
So do we have any new word from the state on those?
I haven't heard anything on my end, so I assume they're still in progress.
Was that an MCO or?
No, so we changed the statute to allow nurse practitioners and physician's assistants to order home health, and there needs to be some follow-up rule changes as well, or regulation changes on top of that, and likewise for telehealth. So the statute now allows for telehealth to happen within home health. So there was going to be some corresponding regulation changes. So both of those, as we understood it, were kind of in progress on DMS's side.
See, Lee, I don't see Lee on here, and that would be her assistant director is on here, who just started yesterday. So I feel pretty sure that Justin, you probably don't have information on that. So I'm just going to assume that we can let you know on that. And
Okay.
Yes, we definitely will let you know.
All right. Thank you.
Sounds good.
All right. What was our first item of new business, Evan?
That would be the XXL pull-ons. So question about
that was my issue.
Yep. Turn it over to you.
Well, thanks. Years ago, there was no extra large diapers or pull-ons on the fee schedule for home health. And now it looks like there is extra large diapers, but not pull-ons. So I was wondering what the process was to get those added, or if they could be added, because there's a diaper and a pull-on for every other size. Not muted, am I?
I keep having trouble getting myself off of mute. I have two monitors, and ends up my pointer is over on the other monitor, and sometimes it sticks over there. Again, that would be a Lee question, and we'll probably have to get back with you on that.
Yeah, I'm gonna keep a list here so we can get all those questions and send them back to you. And I may ask Evan and yourself if maybe you all will email me, and I will put up my email on the chat. If you all can send me an email so that I don't get anything wrong, or that I don't forget anything, and I can get them answered a little more orderly, if that's okay.
Sure. Yeah, we'd be happy to do that.
Justin, we also have Kelly Kitchen from your area on. Kelly, do you by chance know if there's any extra large pull-ups covered?
Hi there. This is Kelly. I'm not aware of any being added to the fee schedule. I am taking notes to bring this by Eddie, the branch manager, and also, of course, Justin being on the line. So hopefully we'll get some answers back to you.
Okay. Kelly, if you have any, as we're going through here, if you have answers to any of the questions, since Lee's not in today, feel free to just speak up and let us know, okay?
Thank you. Yes, I will.
All righty.
All right, what was our second item?
Second item is, what is the timely filing rule for each MCO and
that-
timely filing for secondaries? So I think this is you again, Anlin.
Yes, I was just wondering if all the MCOs could give me their timely filing rule, and especially the timely filing on secondaries, because for traditional Medicaid, it's always been, you had 6 months after you got your EOB from the primary insurance. And that seemed to be what it was in the past, but suddenly I'm like getting refund requests saying I didn't get my secondary in 180 days, but I did have it in 180 days from the date of the EOB from the primary. So I've sent most of those in to our provider reps, but I was just wondering if the representatives here could tell me what those are.
Alan, this is Angie with Medicaid, Angie Parker with Medicaid. And I can tell you, as far as the contract effective 7/1/2020, that it's 365 days for timely filing. Now, before then, 1 or 2 MCOs may have had it at the 6 months. So depending on when your claim, date of service of your claim may be relative to what you're seeing.
For traditional Medicaid for a secondary, is it still 6 months after you get your primary insurance EOB?
That I would have to defer to Justin and or Kelly.
Yes, I can answer that. Actually, Kentucky Medicaid does require or allow 365 days for secondary, except for Medicare. It's 6 months from the Medicare EOB date. So anything after the 6 months for Medicare, that would actually require an overruling. As far as if there is a primary insurance, a TPL, so not Medicare.
Right.
If the provider doesn't receive a response from the secondary, there is a form that can be completed stating they have not received a response, and they can go ahead and file the claim with Medicaid, and then Medicaid will go back to the TPL to gain the funds back.
Yeah, and I think that's what, 180 days, if you hadn't gotten anything from the insurance in 180 days.
Well, the provider can go ahead and file a claim if they haven't heard anything after, I believe it's, I'd have to look to make sure, but I thought it was after 60 days. If they haven't heard anything from the TPL within 60 days, they can go ahead and file a claim with Medicaid, and then Medicaid will go back to that TPL to gain the funds.
Okay, like what most of my issues are is, you know, how you have to fight with the insurance. So they'll pay it, but they'll deny it saying we didn't have authorization. So my EOB says I didn't have authorization. So then I have to appeal to show that I did have authorization. By the time that goes through all those channels, it's another 3 months. So 5 or 6 months down the road, I have a correct EOB. And then, because in the past, it was always you had 6 months from
Right.
the time of your EOB. And on several of the, because for some reason now, I don't know if it's because everybody has insurance now, to where a lot of times they used to not have another insurance. I have so many secondaries, and now suddenly they're either denying them, saying I didn't have them timely. And this is mainly the MCOs, or they paid them and now they're requesting the money back, saying I didn't have it in timely.
Well, with fee for service, for TPL, Medicaid requires a PA no matter what. It's only with Medicare. So as long as Medicare pays, a PA is not required with Medicaid, even if a PA is required.
And we had our PA with
Mhm.
MCOs or with traditional Medicaid. So does any of the MCOs have a response?
This is Kathy Kaufman with Humana. Can you hear me?
Yes.
Ours is 365 days.
Now, is that for just the regular claims, or is that claims and secondaries?
Just the regular claims.
Do you know what your secondaries are? The TPL claims?
I'd have to look that up. Give me just a minute.
Okay.
Thank you.
Sorry, did I miss something? Had walked into the other room.
No, we're still talking about the secondary timely filing.
Oh, okay.
While Kathy's looking hers up, does Aetna or WellCare, Anthem? I'm missing somebody.
This is Jay with WellCare. I'm looking that up real quick as well. Give me just a moment, please.
Okay.
Thank you.
This is Henry Spalding with Passport.
Yes.
Initial claim submissions are 365 days from date of service. And for the secondaries, claims have to be submitted to Passport within 365 days after final determination by the primary.
Thank you. And I guess if everybody needs longer to look it up, could they just send the responses to Charlie and she could get those to us?
Yeah, this is Jay with WellCare. I'll be glad to do that. Thanks.
Is that okay, Charlie?
Yes, ma'am.
Thank you. That'll give everybody time to figure it out and send them in. So with that, I think we can move on to our, do we have a third?
Yep, final topic is traditional Medicaid asking for a signed order. It seems inconsistent at this point. I think, Ellen, you have a little bit more detail on that as well.
Yeah, because that was actually in our April one, and we had talked about it a little then, and we had it happen in the past that whenever we call to get authorization, they want a signed doctor's order. And then sometimes our prior auth says they just tell them that it's out for signature and they'll let it pass. And she said sometimes it's a little harder to get them to let it pass. So, but we always thought that that was not a requirement.
And the issue that was happening back in April, when I brought it up, I think that one actually got resolved, but it tended to be that was more on the private duty side of things. And I think, this one's more of a question on the home health side of things. So, both programs are having a little bit of an issue with this. Is that correct, Anlin? That
Yes.
This is on the.
Yeah, it comes and goes because we had it before and then it seemed to go away and now it's come back again.
And we'll probably have to get back with you, and what we can do is Justin and Lee can come up with their responses and get them to you. Then I'll send them out to all the TAC members.
All right.
And that's it for new business, unless anybody has anything else.
I don't.
All right.
don't know, do we need a motion to adjourn? Or do we just adjourn?
You can just say you're adjourned if you want.
Okay, I guess we're adjourned. I wanted to just thank everybody for attending.
Thank you all.
Looks
Have
like
a good-
Kathleen Ryan's got her hand up. I don't know if she has something to add, but she's got her hand raised.
I'm sorry, did I miss that?
Kathleen Ryan has her hand up. I'm not sure if she has something to add or not, but she had raised her hand on her profile.
Okay, Kathleen, are you still on?
And I know she was, this is Holly with Anthem. I know she was having some trouble with her audio and being able to get off mute.
Let's see.
Yeah, it says in the chat she's trying to get off mute, but must be
Okay.
unable to do it.
All right. Charlie, would you be able, the question about the claims that Ann Lynn had, would you be able to send that to our regulatory at Anthem?
Yeah,
Yes, the ones where they're asking for the orders.
Yes, ma'am.
Okay,
Perfect. Thank you.
all right, well, everybody, thanks for joining us.
thank you. Y'all have a
Thanks,
good
everyone.
day.
Bye-bye.